Rural obesity and weight control. Rural obesity and weight challenges. Obesity is an ongoing issue as rural areas do not have the resources to help combat this health concern, resulting in higher levels of obesity. Some of the challenges are a result of the lack of resources as well as the lack of certain levels of education. Many in rural areas are unaware of health risks associated with obesity and the importance of a healthy diet and of daily exercise. Resources to utilize include conducting health assessments at local schools, town halls, and senior centers. This helps to give insight to the overall health of the community. Speaking with the local health department helps to determine obesity trends and barriers to healthy lifestyles. And interviewing those in the community regarding their knowledge of a healthy lifestyle is also important. Goals of the program. The ultimate overall goal is to decrease obesity rates. This can be done by encouraging the importance of increasing activity levels and providing education regarding chronic diseases due to obesity, such as giving examples of chronic diseases that are caused by obesity, like high cholesterol, high blood pressure, and type 2 diabetes. It is also important to encourage healthy food choices. The target populations include children, adults, and the elderly. With children, we can encourage fun and healthy food choices, and this can be done by teaching parents and school cafeteria employees how to prepare healthy foods in fun ways that kids want to eat. Also by engaging kids in age-appropriate exercises, and this could be ideas such as jump rope or hopscotch that makes exercise fun for kids. Teaching adults how to meal prep, that way they have easy and quick food options, helps to keep fast food consumption at a minimal. And having accessible exercise options such as daily walking in neighborhoods or parks is a great free option for exercise for people of all ages. For the elderly, having access to healthy foods, and we can also teach them about meal prep as well. Educating them on lifestyle modifications such as baking their food instead of frying, and encouraging a daily walk if they're able to, encourage them to go outside, even to walk to the mailbox or walk in front of their home. There are many cultural and cognitive adaptations to consider. Promoting physical activity while also recognizing people's cultural practices and encouraging healthy food options in alignment with one's culture. Being culturally sensitive is very important when providing education. For example, encouraging an increase in or any pork intake to a community with certain cultural populations present would not be appropriate or beneficial. And providing education on healthy lifestyle changes while still observing cultural norms is important for this type of program to be successful. Providing age-appropriate lifestyle changes and goals, and helping people set goals based upon their stage of life and physical ability is very important for success. Effective motivational adaptations include involving the community in healthy lifestyle competitions to encourage involvement. Competition encourages people to push themselves, as most people have a motivation to win when there is competition involved. Encouraging people in the community to establish an accountability partner. Accountability is helpful so that each person is pushed to reach their goal and so that they also have a partner to help them achieve their goals that they have set for themselves. Offering incentives is also beneficial, as incentives create an even higher level and competitive nature in people to reach their goals. Environmental adaptations include encouraging the community to start a local farmers market. A local farmers market allows for farmers to have additional income as well as fruits and vegetables readily available to the community. Working with local schools helps to allow access to playgrounds for kids even throughout the evenings, weekends, and summertime. And providing walking trails and establishing walking groups helps people be active in a way that is free for them. And encouraging involvement for kids and adults on co-ed teams is also a great way to get exercise as well. Program content adaptations include providing fun, interactive material for kids. This could be coloring sheets for kids with ideas of exercise and healthy meal options. It could also be an interactive activity map for kids that every time they eat a vegetable or a fruit or exercise, they can fill in a spot for each of these activities. And once all of the spots are filled in on their interactive map, they can receive a prize. Providing age-appropriate reading material and goals are key so that one is not overwhelmed by their health journey. Program form adaptations include partnering with resources in the community to encourage involvement. Community partnership is key for long-term success of a program. Also, providing access to telehealth services and online resources with additional education is helpful. It is also important to ensure community members have access to a computer as well. Community partner relationships involve formal and informal partnerships. Strong community relationships is key for success of this type of program. Utilization of community resources for information and implementation, and a memorandum of agreement and understanding to ensure goals are worked towards and met by all. Recruitment and supervision of staff. Recruiting staff that value the program and the goals of the program is important because staff with a like mindset will help with program success. You can also start with recruiting staff in the local community. Those already in the community will be driven to help the program succeed to better their community. Consider recruiting community health workers currently involved in the community, and have goals and expectations clearly stated and understood by all of the staff. Staff retention, training, and program liability. It is helpful to have open and clear communication between the members. Providing support to staff is important so they feel that they are supported. Training is accessible and interactive. It is important for the training to be direct and state the desired goals and the outcomes. Having a risk management plan in place. And safety training is important to have for unsafe events or situations that might take place. Some implementation challenges that could pose a risk include differing opinions of staff members. Each person will have their own ideas and opinions of the program, and this can create conflict between team members, so it is important that each person remembers that they are there for a common goal. There could also be community resistance to the implementation. Some people in the community may not see the program as necessary or may not see that it is needed. They also might not be able to understand the purpose of the program and the value that it brings to the community. Based upon the study design evaluation, the quasi-experimental design was chosen. This involves comparing a group participating and a group not participating in a program. This design can help determine the effectiveness of a program. It involves the utilization of quantitative and qualitative data. And through this design, the usefulness of resources in the community can be determined, and also what additional resources might be needed can be determined as well. Framework evaluation. An impact evaluation reviews the effect that the program has had on participants. Did the resources impact the participants positively? What changes resulted from the impact of the resources? What are the participants reporting regarding the resources that are provided? Sustainability strategies. 1 includes strengthening partnerships. This ensures a place for educational classes, and also partnerships can be an additional resource for citizens outside of this specific program. 2, fundraising. Fundraising involves the community. It also allows the program to grow and flourish with available funding. The more funds available, the more the program can do for the community. Funding partnerships. Health Resources and Service Administration is a funding partnership. This is a community-based grant program. It provides 1 year of grant support to help build health partnerships in rural areas. Also, the Center for Disease Control and Prevention, it provides funding through grants to fund public health programs to keep Americans healthy in their communities. There is eligibility criteria that is outlined on the CDC website, and that criteria must be met for a program to be considered for a grant. Both options provide for financial support for rural communities to improve the overall health of the citizens. Methods of dissemination include presenting information to the community. Presenting results to the community during a town hall meeting allows the community to know the impact that the program is having on the community. Also, handing out flyers around town allows people to be well informed without having to leave their home, and it also is a way to provide information to people of all ages. Creating a progress report for funders is important. The progress report allows for funders to know the impact their donation has on the health of the community. It also helps ensure future involvement by the funders. Dissemination audience. Schools, as they will be implementing program goals such as healthy food options and exercise. Funders, as they are the ones helping financially support the program and they need to see how it's benefiting the community. The local community, so they can see the impact that it has on the health of them and those around them. And healthcare providers, as they are able to see the impact that the program has on the health and well-being of the community, helping to decrease obesity-related diseases.